the recording. Okay. Hi, my name's Duncan, and I'm a pharmacist. I'm here to discuss patient Levon Darbinian. He's a 41-year-old Armenian man in the ICU room 214. He has not had a bowel movement since being admitted 72 hours ago. To give some background on this, the patient was admitted to the hospital 72 hours ago, after suffering a motor vehicle accident and sliding on some gravel and landing on the pavement. Once in the ED, the patient was found to have a Glasgow Coma score of 8 and a negative focused assessment with sonography and trauma exam. And then the patient was taken to the OR for an open reduction internal fixation of the knee. And then he was transferred to the ICU. Some of his past medical history includes hypertension and hyperlipidemia. And then his vitals are a temperature of 99.5, blood pressure of 108/92, heart rate of 86, respiratory rate of 18, height of 180 centimeters, and weight of 112 kilograms. His physical exam also showed hypoactive bowel sounds on the abdominal exam, and his relevant medications include the bisacodyl 10 milligram suppository at bedtime, Docusate 100 milligram twice a day, and the oxycodone 10 milligram every 4 hours for moderate pain, and the oxycodone 15 milligrams every 4 hours for severe pain, as well as the continuous IV infusion of fentanyl before today. There was a study titled naloxegol versus methyl naltrexone for opioid-induced constipation in critically ill patients, and it looked at the differences in outcome between naloxegol and methyl naltrexone. The study was a multi-center retrospective cohort study conducted at a tertiary academic medical center and an affiliate hospital in North Carolina. The data was collected through an electronic health record query with dates ranging from January 1st, 2014 to September 1st, 2022. And adults over 18 years of age were admitted to the ICU. The study included adults 18 years or older that were admitted to the ICU for at least 48 hours. They were included in the study. And then as well, to be included in the study, the patients had to have received parenteral opioid infusion for at least 4 hours prior to administration of the naloxegol or methyl naltrexone. And then patients were excluded from the trial if they had a bowel movement within 48 hours of starting the naloxegol or the methyl naltrexone, or if they were pregnant, incarcerated, on a strict nothing by mouth diet, or had been diagnosed with the ileus or small bowel obstruction, or if they had gastric residuals greater than 500 milliliters, or if they had been admitted to the ICU for a burn, or if they had a history of opioid-induced constipation, or if they had previously used an alternative agent for the opioid-induced constipation. This left the study with a total of 161 patients in the study. 110 of them were in the naloxegol group and 51 were in the methyl naltrexone group. There were not a ton of strengths noted in the study, but it was conducted over 8 years to kind of get, I guess, the largest sample size that they could. And it was in 2 hospitals, which I guess is better than 1. There are plenty of weaknesses in the study. One of the main ones being that the sample size was only 161 patients. And then the study was conducted only in 1 state, which was North Carolina. And it was only at 2 different institutions that were pretty close to each other. And then the study participants were also primarily Caucasian, and they had a median age of 57.9 in the methyl naltrexone group and 61.1 in the naloxegol group. This lowers the external validity of the study. And then the goal of the study was to prove the non-inferiority of the naloxegol to the methyl naltrexone, and they use a 10% margin for proving that inferiority. And the primary endpoint was the first time to bowel movement, and the secondary outcomes were the median length of stay, the average number of bowel movements in 72 hours, and That was it. And then in all of those criteria, the study showed that naloxone was non-inferior. However, only the primary endpoint had a statistically significant p-value. With that said, the median time to bowel movement was the 23.7 hours for naloxone and 18.3 in the methyl naltrexone. And then the median length of stay was 14 in the naloxone and 12 in the methyl naltrexone. And the average number of bowel movements in 72 hours was 3.9 for naloxone and 3.8 for methyl naltrexone. So for all of those except the number of bowel movements in 72 hours, the methyl naltrexone was a little bit better. So the patient is a 41-year-old Armenian man, so he doesn't really meet, or sorry, he does meet all of the inclusion and exclusion criteria based on what those were. And then since the study had a mean age of 57.9 and 61.1 in those different groups, and the study was only conducted in North Carolina, and it had such a small sample size, the data isn't really generalizable to this patient just because we don't know if he's in North Carolina. And with that said, the study didn't really show that the naloxone was, it said that it was non-inferior, but it didn't really prove that it was superior either. And then the methyl naltrexone did show like slightly better in some of those categories anyways for those outcomes. And then further studies would definitely be needed to prove that the naloxone was actually non-inferior to the methyl naltrexone. Since the study did not have great evidence to support the non-inferiority, I would recommend using the methyl naltrexone for treatment of this patient's opioid-induced constipation. With the patient's weight of 112 kilograms, I recommend methyl naltrexone 12 milligram injection subcutaneously every other day as needed. I also recommend continuing all other medications for the patient. And I recommend following up with the patient every 2 hours to assess for any the patient for any bowel movements. And then the nurse should also check vitals and monitor for symptoms of opioid withdrawal, changes in abdominal pain, and then ensuring that the patient's pain is still adequately controlled while they're in the hospital. Did you have any questions about that recommendation or want me to put in an order for that?
Yes, I have a couple questions. So we're gonna continue the DocuState and Bisacodal, is that correct?
Yeah, that's correct. There's nothing I could find that would say to stop
Okay.
that in this case.
Okay, and then can you go through, did they look at any safety outcomes in this study?
I believe they looked at a couple. Yeah, the aspiration events, the injection site reactions, and then the positive CAM ICU.
Okay. Good. And then will you just cover your strengths again? I got multi-center, but I wasn't sure if you had any other.
Yeah, just that it was multi-center, and then since they did do it over 8 years, I guess that was a way to get as many participants as they could.
Okay.
And then they also had like they did recognize the confounders at the beginning when they were setting up the study.
Okay. Let's see. And then what do the guidelines say? I mean, do the guidelines make a preference of methyl naltrexone or naloxone?
Yeah, the one guideline, the can't remember the name of it, but one guideline recommended using the naloxone over the methyl naltrexone, but where I was specifically just looking at this study, I went with the methyl naltrexone.
Okay. And then monitoring, you said opioid, or you said bowel movements. What other monitoring did you say?
Bowel movements and opioid withdrawal, and then just any changes in abdominal pain, and then definitely vitals while they're in the hospital.
Okay. Okay, perfect. I think that's all I've got.
Okay.
Okay, you can stop your recording.
Stop recording.